Hi, my name's Kirk and I'm going to be talking about a local football player, Beau Vernon, who in a tackle during a game of AFL dislocated and broke vertebra C5 to C6. C7 is the one that usually pokes out the most, so it's two above that. His spinal cord was squashed and emergency surgery was performed to release the pressure. 4 screws and a plate were inserted, as well as bone from his hip to fuse that part of his neck. The incident left him a quadriplegic with some feeling in his fingers and arms. Beau has had many struggles with his injury, however I'm just going to cover the main few which he indicated to me impacted him the most. First was his movement. With spinal cord injuries, the further up the neck you hurt, the less movement you have throughout your body. Beau's level of injury means that he has movement in his neck, shoulders, upper back muscles, biceps and wrists, while the right side is currently stronger than his left. However, his fingers don't work, as well as his pecs, stomach, lower back muscles and of course his legs. He has no control over his bladder and bowels. Beau has flickers in his triceps, and even though he hopes for these to keep improving, flickers don't necessarily mean the muscle will ever regain full function. Sensation. Beau has normal feeling to just above the nipple line, with the inner side of each arm feeling normal and the elbow side feeling numb. He can hit his elbow and not even know. His thumbs have normal sensation, but this gets progressively worse as you go to the next finger, to the point where he can't feel his little fingers. This is due to where he injured his spinal cord. If he had injured it any higher, there would be absolutely no feeling throughout of his arms. There are also some places down the rest of his body where when touched there is pins and needles. One of these is his feet. Temperature. Beau's body is unable to regulate its own temperature, meaning the receptors that are in his skin that sense a change in temperature cannot send messages back to the hypothalamus. The hypothalamus controls core temperature and sends messages back to the body to tell it to either shiver or sweat so it can get back to the right temperature. For Beau, when he goes outside and it's hot or cold, his body is unable to heat or cool itself back to the normal temperature. He learnt this the hard way when he went outside on a reasonably cool day with just a t-shirt on, and his temperature dropped to hypothermic levels and had to be wrapped in a space blanket for a couple of hours. Spasms. Messages sent to Beau's brain below the area of injury are blocked by scar tissue and nerve damage. So when his body is stimulated below the level of injury, it causes his body to spasm. This is very noticeable when the muscle is stretched, for example when Beau's legs are moved and when some sort of pain occurs below the level of injury. This makes sleeping very difficult when his legs are stretched out. It doesn't give him a lot of confidence in his chair knowing a spasm can happen at any time, and makes transferring very hard. But most of all, he says it's annoying and very uncomfortable. Pressure sores. Pressure sores are caused by lack of movement or pressure on an area for an extended period of time. As he is sitting on his buttocks for most of the day, if he doesn't pressure release every 2 hours or so, he will get pressure sores. He pressure releases by either putting his head between his knees for a minute or by going side to side, taking weight off each butt cheek for a while. Pressure sores can leave people in bed for months, going from one side to another with their body, unable to get up out of their chair. He had to do this for 1 week, when he had a minor pressure sore caused by something as little as the seam in his pants. Catheter. Beau has no control over his bladder. This means that the stretch receptors that are in his bladder that send signals to the brain telling it that the bladder needs emptying cannot be received. For the first 4 months, Beau had a catheter coming out of his penis draining into a leg bag. After that time he had an operation so that the tube now comes out of his stomach in between his penis and his belly button and still drains into the leg bag. Having a bag of urine on his leg is not something that he enjoys at all, and can become quite uncomfortable when it gets full and is noticeable out in public. With the catheter in, he's more at risk of a urinary infection. This has happened a couple of times thus far and caused his temperature to go through the roof, increased spasms and made him vomit. He also had to be careful with his catheter blocking. One time his catheter blocked and he had 950 ml of urine in his bladder before the nurses released it. This could cause him to disreflex or even make his bladder burst. Bowels. The worst part of his day is getting ready in the morning. In the morning, when he was still in hospital, the nurses would come in and put a suppository up his bum. He would wait 20 minutes before he could get up and go to the bathroom. At this point, the nurses would push into his stomach a few times, because he has no stomach muscles to push himself. Then they would give him 5 minutes of his own time. This would be repeated as much as needed, and when done, the nurse would put their fingers up there again to check if he had finished. He hates this process, and it will be the main reason why he'll probably need a carer when he goes home. Dysreflexia. This is a medical emergency that causes headaches, profuse sweating, flushing of the skin above the level of injury, anxiety, and high blood pressure, which can lead to a stroke. The causes of dysreflexia can be a blocked catheter, constipation, urinary infection, injury below the area of injury, and reaction to medication. An ingrown toenail can even cause dysreflexia. And last of all, a fat gut. He was always fit and kept himself in good shape. Now he has a fat gut, as he has no muscles in his stomach to keep his insides there.